Let's talk eye job. Eye job is the most requested procedure in my practice, of course, as I'm an oculoplastic surgeon, and is a very requested procedure because it's the first area that shows sign of aging, the periocular area. It has also been shown that aging is perceived by others when it's especially present around the eyes, meaning the first thing that we see, that we look, that we're noticing when we talk with somebody is the periocular area. And then any sign of aging, a little wrinkle, a little bag, a little skin excess there is perceived. This person is tired, this person is aged, is not in good shape, what's wrong with them? So, of course, we want to take care of that, getting rid of these signs, and we want it equally, men and women alike, because we undergo the same exact aging process. Some of us show it before than others, some of us show it on the upper lids, some of us show it in the lower lids only. Most of us show it sooner or later and equally in the upper and the lower lids. So, in 80% of the cases in my practice, I tend to combine upper blepharoplasty with lower blepharoplasty, just to make it a more profound effect. Now, the surgery is performed under local anesthesia, gentle sedation. It doesn't take longer than an hour and the patient can go home the very same day. Recovery time is quite fast. It's about 7 to 10 days before going back to work. And the most important feature of this procedure is the natural result. We don't want to change the shape of our eyes look. We want to keep our eyes. We don't want to have any funny look about it. We want to just look natural without the things that we don't like, which are the things that make us look older or more tired. So we want to remove the skin when it's necessary. We want to remove the fat when it's necessary. But nowadays, mini-invasive surgery is the key word that many of us tend to prefer when coming to eye jobs. And especially in the lower lids. The lower lids is the most delicate surgery that us as facial surgeons do, as we have to respect their position, their shape, with the corner. We don't have any place to hide a scar if we go through the skin, and we really need to make a profound impact on what the patient asks us. We just don't want to remove the bags just as we were doing in the past, because if we remove the fat of the bags, we just make our eyelids more sunken, more empty. And sunken lower lids is another sign of age, facial fat atrophy. So we don't want that. We want to make a good, smooth transition between the eyelid and the cheek. When we age, we have two different things that happen in this area. The bags in the lower lid and under it, in the cheek, an emptiness, a sulcus, we call it a tear trough, where the tear run down. The tear trough deformity is an area of emptiness caused by the loss of cheek fat. So now we have some fat in excess in the lower lid, just above it, and some fat loss just below it. If we remove and throw away the fat where we have it, that's a big loss. We can use this fat to replace the fat loss. And we can do that through a transconjunctival approach, meaning going in the inside of the lower lid, no scar resulting, and no much reduced risk of complications, and reposition the lower lid fat that form the bags, so the fat that is really in excess, use that fat to reposition it below the tear trough deformity where the fat was lost. So we fill a fat deficiency and we empty a fat excess. So we have the mountain of the top of the mountain caused by the bags, and the bottom of the valley caused by the fat excess. And each of these two problems makes the other more visible. So now if we take the top of our mountain and we use it to fill the bottom of our valley, then we will have a nice flat. And that is the nice cheek lid continuum. This is the goal of our surgery. And at the same time, we can address small skin laxity or lower eyelid laxity by removing a little strip of skin and tightening just a tiny bit the lower lid to make it look younger, stronger, more tonic, without changing the position of the corner or the way we look. If you look at the results of my surgery, of my lower lid surgery, you will see that you won't be able to find anything funny about the postoperative appearance. No major changes, basically, other than improvement in this